Hello, it's good to have you again. Your health, your life, we're broadcasting again. We are truly grateful for the comments that we've been receiving, comments of encouragement. People have been encouraging us to keep going and on to create content that is helpful to them. We're grateful for your comments, we're grateful for your support, and we pray that you continue to do so. We are grateful to have you in our family of your health, your life, and to give you the information that you so need. Today we're going to be talking about malaria. Well, malaria is a very common infection that I think most people in our region are very familiar with. Most people even know that the symptoms of malaria would include a headache, dizziness, nausea, vomiting. Some people may even present with diarrhea. Of course, people also have generalized body weakness and joint pains. And almost out there in the community, almost everybody knows that those are the symptoms of malaria. And in most cases, people even go and get over-the-counter drugs and treat themselves with malaria, which is a good thing. Well, not always. You see, malaria also has bad and dangerous complications. And these are just some that I want to go through today so that we just get an idea that not every form of malaria is simple and some may need you to rush the patient to the hospital. So one of the complications is something we call cerebral malaria. Sometimes the malaria can affect your brain and some people are going to have what? Fits or convulsions. So that is a serious complication and somebody has to go to the hospital. Some patients can present with something we call pulmonary edema, which may be characterized by them having difficulties in breathing. And this comes about because they have fluid accumulating in their lungs. That patient needs to go to the hospital. Some patients, because of the disease process in malaria, can have severe anemia, which simply means that the malaria parasite destroys a lot of their blood cells and they only remain with a little. Those need to go to the hospital. Some malaria patients can present with renal failure. All of a sudden, this person is unable to produce enough urine. This person will go to the toilet maybe 3-4 times a day. Doesn't go to the toilet at all the whole day, despite you giving them fluids to drink. The person may have severe malaria with the kidneys failing. That patient needs to go to the hospital. A patient with malaria who just sleeps around all day with nothing to do, we call it prostration. He has no energy to do anything. He just lays sickly ill in bed. That person needs to go to the hospital. There's something we also call black water fever, whereby someone's urine just looks black. Black, yes, just black. That person needs to go to the hospital because they are also at the risk of having failing kidneys. A person with symptoms of malaria that may be bleeding from everywhere, from their nose, from their eyes, from their mouth, you definitely take that person to the hospital. What are we trying to say? We don't know exactly at which point these complications of malaria are going to set in. So what is the best thing? Even if you are confident that your relative or you yourself have malaria, go to the hospital so that doctors can look for all these complications and tackle them while there is still time. Because if you go late, there may not be enough time to salvage the patient. Of course, these complications don't happen in most people. They only happen in a handful of people with malaria. But you don't know exactly which one of your relatives, or your siblings, or your parents, or your children are going to have these complications. So whenever you can, don't treat yourself with malaria. Yes, it may be simple. All you have to do is get some Coartem. But trust me, if this complication set in, the last thing you want the patient to be is at home. I'd also like to announce, like we did last time, that we have partnered with Medical Health Consultancy. Medical Health Consultancy is a company that deals with employee health. And the main mandate is to promote employee health and making them more productive. And how do they do that? By making them healthier. This they do by screening them for non-communicable disease and giving them practical medical advice to help them live. Medical Health Consultancy also gives health talks on things that are there of concern to the public, like COVID-19, vaccines, and all. Well, this is the team from Your Health, Your Life. Thank you very much for supporting us. Please continue supporting us and following us on our social media feeds on Facebook, YouTube, Instagram. From Your Health, Your Life, have a lovely day.